Good afternoon and welcome to this event to discuss how the new government can rethink the approach to public services capital spending. I'm Gemma Tetlow, IfG Chief Economist, and I'm delighted to be chairing today's event. The event today draws on a report that we put out just before the election looking at the question of capital spending in public services, what's worked, what hasn't, and how can a new government take a different approach. It's work that we've been doing in partnership with Grant Thornton. I'm really pleased that we have Grant Thornton on the panel and thank them very much for their work, for their support for this work. Failing public services featured pretty heavily in the general election campaign. And over the last year and more, I think there have been growing numbers of stories highlighting that one of the issues of public services right across the board is problems with the buildings and the equipment they have to work with. We've had a lot of stories of NHS hospitals with leaking roofs, with very slow IT. 100 schools last September had to be closed at the start of term because of rack was discovered in their buildings. And just last week, we obviously had a lot of debate and controversy around the new government's proposals for early release of prisoners, which was their way of dealing with the inheritance they got from the previous government, which was a failure over many years to deal with the mismatch between the number of prisoners we had and the number of places that there were through a lack of new building and maintenance of the prison estate. So I think it's a really timely moment to be talking about this question and discussing how can this new government take a different approach to capital spending, what have been the problems in the past, and what could the next spending review do differently to make sure that we're on a different path in future. We're going to start the event with a short presentation from my colleague Tom Pope, who is one of the authors of the report, setting out the headlines of some of our findings. And then I'm really pleased that we've got a great panel to help us discuss the issues. We have Wayne Butcher, who's the director from Grant Thornton. We have Anita Charlesworth, who is now Director of Research at the Health Foundation, and also earlier in her career worked as Director of Public Spending in the Treasury. We have Sir John Coles, who is now Group Chief Executive for United Learning, a large academy trust, but also previously worked in government as Director General for Schools at the Department for Education. So we've got great expertise across a range of public services to talk about the issues. We'll be live tweeting this event. My colleague Ollie Bartram will be live tweeting, and he'll be using the hashtag public services and hashtag capital spending. So please do follow and tweet along. Please do start sending in your questions if you're watching online using Slido. It should be the panel next to the screen that you're watching us on. I can see we've already got a few questions coming in, so please do keep sending those in. We'll get to audience Q&A after we've had a bit of discussion amongst the panel up here. But without further ado, Tom.
Thank you very much, Gemma. And I think Gemma's already very nicely motivated why we're doing this event and why we did this piece of research looking at capital spending in public services. There's increasing evidence about the crumbling estates in some of those public services, and also more evidence, particularly in the NHS, of a link between the quality of capital stocks and the productivity crisis that we've seen in the NHS. A big increase in spending in recent years that hasn't really translated into more activity, and that's been linked in our work and in others, including at the Health Foundation, in part due to capital. So I'm going to run through a few of the key findings of our report. We set out some facts about capital spending on public services, and then a bit of our diagnosis for what the current problems are and some of our recommendations for what the new government can and should do. So a few of those facts then. The first is that the UK invests less than the international average. Now that fact is true almost however you cut it. It's true that combined the private and public sector invest less than in other countries. It's true for the public sector as a whole, and it's also true if you look specifically at investment in public services. So this chart shows investment in healthcare across OECD countries, showing the range across different countries and the average. And across the past 50 years, the UK has been above average in only 2 of those years. And we also show that, although over a shorter time period, in education, the UK also stands out for its relatively low level of capital spending. So that's a long-term trend. We also saw during the 2010s a significant cut in capital spending for public services. So this chart is going to show capital spending based in 2007-8. So that's just before the stimulus in response to the financial crisis. And this chart shows overall capital investment by departments, shows quite a big fall during the 2010s. Although a rebound since. And if you look specifically at public service departments, you can see that both the cut during the 2010s was larger, and the increase since has not been as large. And that's because lots of those increases have come in other areas like economic infrastructure and business, including R&D and environment. And it's only local government that has fared even worse than public services. As well as that clear evidence then that the UK doesn't invest very much in public services, we also identified a few facts that made us worry about the quality of that spending, that budgets that were being allocated were not being spent as well as they could. The first bit of evidence is on this slide, which shows transfers from capital budgets to day-to-day budgets in the three public service departments that we look at, the DfE, DHSC, and MOJ. Now, this should be banned under Treasury rules. You shouldn't be allowed to use some of your capital budget to fill short-term gaps. But over the past 10 years or so, particularly during the 2015 to 2019 period, where the 2015 spending review proved to be insufficient, you saw quite a lot of use of capital budgets to fill those acute problems in public services, but therefore obviously less investment than originally planned. Last year, both DfE and DHSC used some of their capital budget to pay for the higher pay awards that were a result of ending the strikes. Now, even after you account for those transfers away from the capital budget, those budgets also tend to be systematically underspent by quite a large margin. So this chart shows the share of capital that was budgeted for but was not spent in each year. You can see it's consistently hovering around the 5 to 10% mark in all of these departments. And that reflects two things in particular. One is a problem particularly with major capital projects in delivering on time, persistent delays in large projects. It also reflects the incentives that permanent secretaries as accounting officers have to underspend rather than overspend their budgets, and they get a very hard time if they overspend, not so much if they underspend. And then the final bit of evidence here, this chart shows capital spending for each of our departments in each month of the year for 2022-23. So with April on your left and March on your right. And the key thing to point out here is that very large spike right at the end of the year in March. Departments have limited flexibility in shifting their annual budgets across years. And so when you get towards the end of the year, there can be a bit of a use it or lose it mentality. Now, there are various ways in which they're able to score money in that final year, but this raises at least some concerns that the value for money of that spike is not going to be as high as if you saw more consistent spending across the year. Our report also has lots of evidence that there have been consequences to relatively low levels of capital spending and that capital not being spent as well. I'll just show one in the interest of time, and this is the maintenance backlog in hospitals, so the amount of money that would need to be spent to fix identifiable problems with various bits of equipment and estates. You can see that it's almost £12 billion in 2022-23, and that it's continued to increasing even though there's been an increase in capital spending in recent years. So our report then goes on to look at the allocation processes for capital spending in more detail and identify several areas where they're not working as effectively as it could. And I'm going to run through these very briefly. So the first is our politicians don't always make the best decisions around capital spending. And there are two issues in particular that we highlight here. One is a tendency to be short-termist, perhaps to announce projects at quite short notice and indeed to decide to scrap them. And one issue there is that has an effect on the private sector. It makes it harder for the private sector to invest in the factories that might allow them to produce things at a better value for the public money. There's also a tendency for politicians to favour shiny new projects over perhaps more run-of-the-mill things like maintaining your existing estate. We find that spending review processes are also not always conducive to the best outcomes. In particular, it can be quite hard to make the case for maintenance. There's a tendency that the Treasury displays to offer the minimum viable amount to get a project off the ground, which may not necessarily be the way to run it most effectively. And has also been a mismatch between the money awarded and the timeline that it's been feasible to deliver some projects in recent years. Spending controls also skew departmental incentives towards underspends rather than overspends, as that previous chart showed. We find that departments' approach to spending their own allocations can be too centralised. There can be too much of a tendency to use competitive pots to choose which projects are best, rather than allocating by formula to delivery bodies that might know which projects are most effective in their area or in their estates. There's also it's very rare that multi-year certainty that's provided to departments by the Treasury cascades down to their delivery bodies. So they tend to offer 1-year settlements. Now, one caveat here is that we find that certainly in some schools and in prisons, there isn't necessarily the capacity in delivery bodies to make some of these strategic decisions. That means that from now, it would be quite hard to radically decentralise. We also find that services don't always have an adequate understanding of their capital needs, in particular their longer term needs. There tends to be lots of focus on what needs to happen over the next 2 or 3 years, say covering a spending review period, but not that more strategic look of where does the estate need to be in 10 or 20 years, and what does that mean about how we should be prioritising investment now. And finally, we find that the government always doesn't work as effectively with the private sector as it could. That's partly linked to the boom and bust cycle of investment and the lack of certainty over projects that I mentioned earlier. And we also find that in the approach to contracting individual projects, the government doesn't always follow the best practice laid out in the Cabinet Office's construction playbook. So what should the new government do about all of this? Clearly a tricky inheritance. We have lots of recommendations in our paper, but in the interest of time, I'll just focus on the top 3. So first, we argue that the next spending review, which we think should, a multi-year review from next year, or set next year for the year after next, should cover 5 years. And we think that it should provide public services a more capital-intensive mix of spending than in recent years, if it wants to deliver good value for money out of the day-to-day spending that it will want to add to those public services and to improve productivity in those places. Now, that's going to mean difficult decisions. Spending more on public services capital could mean spending less on day-to-day spending or on infrastructure investment, or it could mean taxing more or borrowing more. There are no easy decisions here, but we think it is really important that this is a priority at the next spending review. We also say that every service should produce a 10 to 20-year estates and equipment plan, and this should do primarily 2 things. First, it should set out estimated needs of the estate over the next 10 to 20 years. So how many schools are we going to need in 20 years' time? How much rebuilding of the existing estate or building of new schools do we need to do in that time? And because that's not going to be a politically contentious thing, generally, we think the government should be willing to commit to longer-term pipelines of projects in these areas. And second, we think that this plan should set out a robust estimate of the maintenance required to keep the existing estate in good condition. We argue that these plans should be published, and that means that at the next spending review, if the government was, say, allocating less to maintenance than the evidence suggested was best practice, they would need to explain why they were doing that. And finally, we suggest that accounting officer responsibilities should be rebalanced, that there should be more focus on whether they're adequately maintaining their existing assets, and that there should be a more balanced scrutiny of underspends as well as overspends. There are 2 main ways that we suggest that this could happen. First, we think that select committees could do more to interrogate both ministers and permanent secretaries on these questions. Having published estates and equipment plans would help there because they could hold sessions with the relevant officers looking at that. But we also argue that managing public money, that the Treasury's spending handbook should be revised to explicitly allow for accounting officers to ask for a ministerial direction if they feel that a decision not to spend on adequate maintenance of the existing estate represents poor value for public money, because it's just storing up higher costs when those estates are more dilapidated further down the line. That's all from me, and I look forward to hearing the thoughts of our panellists.
Brilliant. Thank you very much, Tom. Anita, let me come to you first. You've worked both in the Treasury and subsequently outside looking at the NHS. What do you think are the most pressing problems with how government has approached public services capital spending, and what do you think are the priorities for improvement?
Yeah, so I think there are 3 fundamental problems which the report and the analysis is a helpful contribution to. The first is that actually a lot of our processes for capital are project-based rather than strategy and program-based, and aren't really there. Therefore, there's a disconnect between often what we're trying to achieve in a public service and the approach to capital. So we have very robust processes around business cases, around Green Book guidance, which are all very project-specific, and a lot of accountability is driven by project. But if I look, say, at the NHS and what it needs to do, Wes Streeting has announced that there's going to be a 10-year plan for the NHS and social care, and that's really, really welcome. And Professor Lord Aradazi is now doing this, what's, if you like, the state of things. But almost certainly in that 10-year plan, we are going to need to address the productivity puzzle and get to a position both where we recover productivity and we have a sustained improvement in productivity. There are capital implications from that. We've also known for a very long time that health needs is changing, and the health services supply configuration doesn't well meet those needs. So it's still very body part organised, very, so you're a hip, a heart or a lung rather than a person with multiple things. And we've talked for 30 years about more care being delivered in a joined up way, closer to people's homes, supporting them independently, and yet through that period of time, we've spent more and more consolidated in the investment and rescue end. So there's an allocative inefficiency, and again, there's a very strong capital element to unlocking allocative efficiency. And then the third thing that we're pretty clear at is that health needs are changing, but they're also increasing, where baby boomer generation are entering old age, and we've got lack of capacity. Yeah. Now, so individual projects, don't. If you look at everything through a project lens, you don't really get that sense of, okay, there are these multiple challenges. What across the piece then, if we look at geography, is needed to address that? How do you shift from where we are now, because you don't do that overnight, to a health system that meets that, and what are the capital implications of that? So it's only by having that strategy that you can be clear, and then you need a budget, obviously, with a time frame that's realistic for that. The other thing which you see, which your report really nicely focuses on, is an enormous amount of effort in our system to the initial decision on a project. A huge amount of efforts on the initial decision. And then in the sort of slightly classic British civil service way, we get a bit bored. And we have tried, I think, in machinery government to bring more commercial discipline in and get a bit more interested. But fundamentally, the amount of effort that goes in, not just in the Treasury, but in the department and out in the delivery system, on the new and the initial decision versus actually the follow through, the delivery, the realisation of value for money is really clear. So, personally, I'm a big fan of the directions issue and trying to, wherever we can, put more checkpoints in the system that make it harder to do the wrong thing. I think there's quite a challenge in that, though, when you start to think out to the system. I've worked as a non-exec in the NHS for a long time, and NHS actually Gareth Southgate's been England manager for a long time, hasn't he? But generally speaking, being a football manager has been a very short-term occupation. Being an NHS manager has been even more of a short-term occupation. And a lot of the sort of changes that I'm talking about don't win you a lot of friends initially. It's quite hard to make your career as an NHS leader really trying to do the right thing in terms of capital and seeing that through. And so we do have an incentive issue, not just nationally, but as it flows through the system. And I can't speak for education or prisons, but I do think that is also an issue. Locally, that's important. And then the final thing is, I think, that we see in the NHS, which again is mirrored in a lot of what you talk about, is that if we made good strategic decisions, we got more capability in the system to actually manage and follow through those decisions from strategy into delivery. One of the things that we need then is the alignment of the funding and accountability arrangements through our system. And that actually, I think, looks really quite difficult. So there are a number of issues. Certainly in the NHS, we have a system of capital allocation and capital controls really, which is still rooted in an internal market, which was the dominant, obviously, model for public services in the 2000s, which was very much that you had independent autonomous organisations. They were able to earn money through a sort of payment by results system. That payment by results included a reasonable return on capital if you were a successful organisation. Therefore, you could afford to invest capitally and you were incentivised so to do. And so money sort of would then flow through that, and then you had PFI. So we abolished PFI and we've abolished the internal market, but we haven't really put anything in its place. So how do you allocate capital appropriately, link it to needs? How do you address the revenue implications of capital so that the areas that have greatest potential for return on capital can actually afford to do that and have the resources? And how do you align that with a wider incentive framework? And the boring job of the financial flows through the system doesn't feel like it's yet aligned. All of which to say is that I think there's a lot of very detailed work to be done in a 10-year plan.
Excellent. Well, DHSC will be very busy for the next few months then. John, let me come to you next. You actually recently put out a paper setting out some of your thoughts about how government can more effectively decentralise responsibilities to some delivery bodies. So what do you think the government could do better here?
Yeah, no, and I mean some very important points in the paper, I think, and agree with a number of Anita's points, particularly the kind of shock of the new in the civil service and in government, and the desire to focus on policy, new ideas, new initiatives, new projects, and insufficient attention systemically across government and beyond to what actually matters most, which is the quality of implementation and execution of decisions, which is what actually makes the difference to the quality of public services. So I think there are some big important points in here. The piece I wrote, which was focused on particularly government for education, I mean, made the point really that government has become, over the last 35 years, progressively, incrementally, year by year, more centralising in its approach to virtually everything, to the point at which government has a disproportionate and very unhealthy and dysfunctional level of control over far too much of what happens in schools. And this is mirrored to some degree across other public services, but I think it's acute in education. And this is not to say that I'm making an argument about any one policy rather than another. You know, there are visible rationales and reasons for lots of centralising decisions in relation to each specific policy where that's happened. But the combined effect of all of that has been a reduction in the capacity of schools and the education system to think for themselves and solve their own problems. So I think there's a really important moment and a possibility here of a new government setting out to reverse the direction of that. Now, if you want to reverse the direction of that, which I argue is a really important thing to do if you want to raise the standards of education in the country and hand more control over to school leaders, trusts, more influence to parents and so on, then you need to build the capacity of the system. You can't just decide these people are now going to do something which they're not actually set up or equipped to do. You have to do it progressively. You have to think about your regulation from that perspective. And in a sense, capital is the most difficult test and possibly the last of these things that you can do in schools. Because schools, frankly, are pretty small organisations, really. They're nothing like the size of a big acute hospital trust or something. And even we, as the largest group of schools in the country, we educate 75,000 children across the country. We have 100 schools. We turn over £750 million, which is large for a group of schools, but it's not large for the biggest NHS trusts, for example. And meanwhile, across the country, there are 2,000 academy trusts, each of which has nominally got the same level of independence as we have, but most of which are very small and lack the capacity to really genuinely be an independent public service on their own. Frankly, nobody in their right mind would organise a public service to have 2,000 independent organisations delivering it. So we need to consolidate that, importantly, and over time we need to build capability. As we build capability and capacity, we can devolve more things. I think the level of current devolution of capital has some sense to it. So about £10 million gets devolved, roughly speaking, give or take, to us in in a year, which is obviously, to go to one of the key points of the paper, an inadequate amount of money to look after properly 100 schools. But it does mean that we, and I think this is unusual in education, have a complete view of our backlog maintenance, an understanding of what we need to do, have prioritised and organised that in a 10-year plan to deliver, adequate buildings and deal with all the backlog maintenance of schools that are joining us. So I think that's all sensible. It does lead to, your slides are off the screen now, but I noticed on your slide 6, that there's a peak of throwing money out the door in July in education, unlike all the other services. Well, it's exactly the same phenomenon. It is the last month of our academic year. It's actually August, which is the cut-off for spending what's called school condition allowance. But July is the last month of the academic year. So you see this end-year peak, which goes along with an end-of-March peak for some other things that are going on. It's exactly the same phenomenon, inefficient allocation programming. I personally think that if you're running an organisation and you're allocating capital, the timing of your capital spend ought to be much, much less important than it is now. And this idea that we can't carry capital over year ends really needs to be ditched properly. It can be properly accounted for, managed, and looked after, and people can be held accountable for it without there having to be this kind of sudden rush to spend at year ends. So just to give you then one example from our point of view, we have a school where we need to spend £18 million on sorting it out. The government has had a programme of complete school rebuilding. It hasn't qualified, although schools which would be lower down our priority list for rebuilding have qualified. We have tried to get that changed with the government. Can we swap schools to deal with the biggest priority? The answer to that is no, we can't. And so we've got an £80 million bill that we have to meet in a world where we get £10 million of capital every year. So there's a real mismatch here between capital need, properly identified, our ability to actually manage as an independent organisation, and the allocation mechanisms that we are faced with. So I really welcome this report, because I think it's highlighting a set of really significant issues for us.
Right, thank you very much. Wayne, coming to you finally. What are the key issues that you see in your work with clients, and what do you think are the opportunities for doing better in this space?
Well, I think probably the starting point in terms of the main issues we're seeing with our clients is that lack of budgets. And clearly that's obviously not new news, but it's more than just quantum and how our clients respond to, I suppose, the erosion of budgets over the last few years with regards to high levels of inflation and increased interest rates. And alongside that, I think there are a number of drags that we tend to see on a common basis with the clients that we work with. I think in terms of that first drag, the piece around the speed of decision making and that ability to be agile and being able to deploy capital at the right time for the right types of projects. We often get involved in a lot of PFI schemes where they're now approaching handback within the education, prisons and health sector. And actually, that starts to become particularly problematic when you're seeking to create a funding solution which combines public sector investment alongside that private sector investment. And I think maintaining the private sector's appetite to continue to want to invest in public services is a bit of a key risk at this stage. And I think that's going to be core to how we fundamentally take forward the number of projects that we want to deliver going forward. I think governance and politics is obviously an element which has hampered us in the past. The new hospitals programme is a really interesting programme in terms of a big vision in terms of what wants to be delivered. But obviously in terms of COVID and then challenges around budgets, that has hampered the ability to really sort of kickstart that programme and start to see real change in real time. And I think it's interesting. I don't just work across prisons, education and health, but I do a lot of work within the wider housing and regeneration sector. And I think there's a danger that where we have that inconsistent view and a lack of commonality in terms of what stakeholders want, you potentially end up in a situation where there is confusion in terms of the asset that you're trying to deliver alongside the need for public realm, related infrastructure and so on. And you lose the view of the wider strategy that Anita touched upon earlier on And there is always a danger of being sucked into the project-based approach around ticking boxes and not necessarily getting to a point where you're delivering what the ultimate ambition was at the start. And I think balancing that short-term deliverable and showing change in real time, which everyone within the public wants to see, combined with that long-term vision, which also then aggregates that piece for around a multi-year review in terms of capital allocations, that's quite a difficult thing to try and balance. I suppose then, in terms of then, so where are the opportunities? I suppose I would step back and consider, okay, we want to shape opportunities that have long-term strategic impact. And I think secondly, that piece around innovation and making most of the resources available. I suppose there's lots of opportunities I could talk about, but there was 3 main items that I wanted to share this afternoon. So I think number one, I think there is that opportunity in regards to tactics, and I'll call it tactics in terms of the timing and the ability to fast track certain decisions and having a much more commercial approach to how decisions around capital allocation are made. I think often we sort of end up in a position where the governance should be around that final decision, but actually having governance where there is that regular interrogation and testing of projects is core in terms of challenging the parameters, the assumptions that feed into those capital projects. And it was interesting how Keir Starmer touched upon his mission delivery boards, which I think really looks to create that conversation in terms of what we're trying to deliver and have that regular review and sense check of what we are trying to deliver on the ground. I suppose number 2 in terms of the opportunity, that piece around public sector reform. Obviously the Prime Minister was instrumental in reshaping the CPS, and I think he already sees that opportunity in terms of bringing local and central government together in terms of how they can use their budgets in aggregation to really maximise the impact of what's being delivered on the ground. We saw a first indicator of that in terms of the meeting of the mayors last week, and just thinking out loud in terms of the combined authorities that we work with, there is probably a bit of a theme in terms of those are the projects which tend to progress, there is a consistent view of what is trying to be achieved, and actually those monies are being drawn out of the door in terms of the delivery of those projects. So I think that's a theme we'll start to see, and there's also that broader piece as touched upon earlier in terms of the capacity building in terms of the people needed just to deliver these projects. And number 3, public-private partnerships. I think you can often get sort of drawn in the history of how the private sector has worked with the public sector, but I think most people do recognise that private sector investment is needed, and we also understand that a private sector return is also required. But I think all too often we tend to get drawn into either the private sector is delivering everything or nothing at all, and actually there's a number of components in terms of the delivery of the asset, the delivery of the service, and the provision of the money to actually deliver the project on the ground. And actually, they're quite different things which bring different requirements, different expertise, and obviously different returns on capital. So I think taking a step back as we start to look forward in terms of the delivery, whether it's within the NHS, the education sector, prisons, or more broadly, I think it's going to be really key that we have a clear model to evaluate and understand projects on a much more customised perspective than we have done in the past.
Thank you very much. So perhaps I'll start with a question of quantum of capital spending to each of you. We've sort of touched on it already, but I'd be interested to the extent to which you all think more money is needed to address these problems. And if so, where could that come from? What are the trade-offs? Perhaps Anita, I'll start with you.
Yeah, so we did some modelling in the run-up to the election around funding needs going forward for the health service. And that would suggest that at the moment the capital budget for the NHS as a whole is about 12 billion, and you'd be wanting over this Parliament to get to at least 20, I think. And I think to this point, actually, structurally, and that's not short-term, structurally what we're saying is that we've got the mix between revenue and resource wrong, and we're an undercapitalised system, and that's a drag on our long-term productivity. Now, quite interesting, a lot of that, therefore, will be on sort of capital that we haven't touched on today, which is digital and IT. So it'll probably be a slightly different mix of capital going forward. So I think there is a real question about can we come up with a spending review proposition which is capital biased, and how over the longer term do we shift across all public services? And obviously what you're hoping for there is that you get the productivity gain, so that actually a more capital rich, although that squeezes revenue, you get more out of the revenue in the longer term, so outcomes are sustained. But it's a big transition effect in getting to that. You know, none of that happens overnight. And you're trying to do that rebalancing and restructuring of public finances at a time in which there are immediate, really profound access and quality issues in the service on which probably political futures will be determined when you've promised not to put up any of your main taxes, and so and PFI is kind of has been ruled out by the previous government. We're interested to see. So that looks quite like a Gordonian knot, doesn't it? And something is going to have to give in that. But I do think, though, that that there is more political win in capital than often that narrative that I just outlined might suggest. In that, I think for staff and for people using public services, one of the things that makes them feel undervalued if you're a staff member is working somewhere that isn't fit for purpose. One of the things that people see in their local communities and in their public services is shoddy, not fit for purpose facilities, which say that we don't care as a state and we don't value this service. And so even if it takes time, you know, for the full benefits to arise, actually I do think public and staff obviously have a very good appreciation of what's needed, and we'll see that it is actually, we do need to fix the fundamentals. That does really matter. That does shape what can be done, and is a priority. So I think with some good, it is not impossible to make, and Keir Starmer has very much, is stalled out by serious government. So I don't think it's a completely unwinnable debate, but it is a very tough time to do that in. Yeah.
Wayne?
I think in terms of the work we've tended to be involved in, I think it's about understanding the potential future income streams that potentially could be ring-fenced to support, let's say, the repayment of capital where there's private sector involvement. We've seen a lot of I suppose innovative models around items such as land value capture, retention of business rates, council tax, which have been models which have been used to deliver wider infrastructure, housing and regeneration. And in my mind, it's a case of, is there something around trying to use those models and trying to apply them in a slightly different context just to make the money go further? A bit of thought is needed around that, but I think that's an interesting sort of take. I suppose in terms of the second piece, there's probably that element around competition. So it's interesting, the report touched upon, there's probably a reluctance in terms of where it's local authorities, departments wanting to necessarily compete for capital. However, I do think there is some merit in terms of really focusing minds around what the end product looks like and really challenging yourself to understand, okay, how can we potentially make that budget go a little bit further? So that would be the other item I would throw in, and really sort of stretching that value for money argument. But I think in agreement with, as Anita was touching upon, I don't think there's necessarily going to be cascades of new money. So that piece around being inventive, I think is going to be key.
And when you say competition, do you mean having more obvious transparency about what sort of cost benefit of different projects are, so others can learn from that? Is that
definitely? So I think that's definitely one aspect, and I think actually just an openness in terms of having a cold pair of eyes, review and challenge. I think we all know when we work on a project, you can get sucked into the detail, and actually having someone to come and kick the tires on that project and really ask, have you thought about this? Why have you gone down this route? I think that can really make, when it's done properly, can really sort of often unlock and enable some further value.
John, what about in schools?
So I think the question is it just about money? Well, I mean, so I think the analysis of the report is basically correct. There's not enough money and it's not well spent enough. So, I mean, let's make sure it's better spent, firstly, because we can definitely do that. And that will drag out more value from it. Secondly, I think this core point that the routine and unpolitically attractive job of maintaining what we've got is fundamentally important to the quality that people experience in their public service. And I do think an advantage of capital expenditure done well can be, as Anita says, that you see in your community, oh, that is better, in a way that, you know, if the quality of teaching in your local school improves, you can't really tell as a member of the public. But if something looks better about your school, you can tell. So even things which are not grand, shiny projects do have a degree of attractiveness to them. And I think it's important. But the test here is, am I seeing, you know, in schools that we take on, more of the equivalent of, as it were, potholes in the road? And the answer to that is yes, I'm afraid. You know, there is, and I mean, we all see more potholes in the road, I guess, those of us who drive. There's no getting away from the fact that there are maintenance issues across all of our public services. It is visible in schools. That isn't just about how well the money's been spent. That is about a lack of quantum. So that needs to be addressed. But there's no point us sitting here saying that's an important thing to do, as if that's an easy thing for a government to achieve, because I agree with the point. We want something that's a more capital-rich mix of expenditure, but that's not going to happen overnight. We're not going to be seeing enormous increases in public expenditure, nor are we going to be in anything like a position where we can see significant cuts in revenue expenditure in public services, which feel stretched in a range of ways. So we need to think about this in the very long term, I think. What is our mid and long-term financial strategy for government, and how are we going to get from where we are to where we really need to be over a period of years in the least painful way possible, doing the most important things at any one point in time, while retaining a long-term strategic intent to change that balance. That's the very difficult job that this government has, I think, in this space. And there's no point us sitting here, you know, pretending there's an easy fix, because there really isn't. I think similar long-term thinking about revenue expenditure alongside capital expenditure is extremely important. There are things that we can do differently in the way that we spend on the revenue side, which may make some of these choices a bit harder, but none of this is straightforward.
Tom?
Yeah, I think that's a really good point. And I think we would worry even more about how well capital was spent if the government suddenly next year tried to double capital budgets. And we've seen that governments historically have struggled, when there have been those big changes, struggled to get money out of the door to develop projects and so on. So certainly thinking about that strategy is right. I think that the two can go hand in hand of demonstrating that you're spending money better and increasing spending over time, and actually probably an important precondition for winning the right to increase spending, as it were, is to demonstrate that you are going to spend it better. And I think some of the recommendations that we look at, particularly in terms of some of the bigger building and rebuilding programs, of committing over a longer time scale in a more consistent way that may lead to better value contracts, because the private sector can invest in the as I said earlier, in both the workforce and the factories and so on, that mean that they can deliver similar buildings. Certainly in schools, a real possibility for having pretty standardized building that you can roll out across the country when schools need to be built or rebuilt. Could generate savings there, and could also lead to more consistent timing of how long these projects take, because that's been the other problem, is consistently delayed delivery. But I think for all of the ways in which we identified some flaws in how the money was spent, the reason why we came down on then there does need to be some more spending is that we didn't plausibly think that fixing those things would, if you fix all those things, the money would still not be sufficient. So I think more spending is needed.
Great.
I'm not sure how completely committed the new Chancellor is to the previous government's fiscal rules, but I mean, if I was her, I'd think maybe about giving myself a different set of fiscal rules at this point, which allowed me to invest more. And I'm not sure if that's already been taken off the table. I'm not following the government as closely as I used to do, but it seems to me that these rules, which don't treat capital and revenue differently, may be unhelpful in the current situation.
Tom, do you want to?
Yes, I think Rachel Reeves has, as far as she So it's gone pretty far in committing to the rules that were in the manifesto, which means that the binding rule of those, so she does have one rule that does distinguish between capital and day-to-day spending on having a current budget balance. But at the moment, that wouldn't be the binding rule. It would be debt falling. And as you rightly say, John, that doesn't distinguish between the two. I think there are various ways within the definition of that rule that she could create some extra space for herself, not least by changing the definition of debt to include the Bank of England's, again, for reasons that we don't need to go into here. But that would be a defensible move, certainly. I think one concern I have is that a rule that binds in 5 years' time, there is an incentive to commit to spending more in the short term but not in the long term, which would lead you to exactly the trying to pump the capital in quickly because you can afford to do that under your rules, but therefore getting worse value for money for it and not providing that long-term consistency and certainty that I think we need.
Great. I'll take a question that's come in online, as it covers an issue that we do talk about in the report. We haven't really discussed in much detail yet. So the question is from an anonymous questioner. How can government prove at the spending review to the Treasury that investment in social infrastructure is as important, if not more important, than economic infrastructure, given it's harder to prove a direct or quick impact on GDP? Tom, do you want to start, and then I'll come to the other?
Yeah, so we did look at this in quite a lot of detail in the paper, and the challenge, certainly if you just look at the economic case, the cost-benefit analysis is not always as clear for social infrastructure as it is for economic infrastructure, not least because we have very well-established models for the impact of filling potholes or a new roundabout on growth in a way that we don't in the same way. Part of the issue is that lots of the payoffs on social infrastructure are going to be in the longer term as well, and they're not going to pay off necessarily quickly enough for them to be fully incorporated, certainly if the benefits focus mainly on a 5-year time horizon. One thing that's really important is that the Treasury doesn't only appraise things based on a cost-benefit analysis. The Green Book has 5 cases, and the one that they've increasingly been putting more weight on is the strategic case. So effectively, how far does this contribute to the government's priorities and objectives? And we've heard that over time on capital spending, they've moved away from effectively putting lots of projects in a spreadsheet, ranking by economic case and seeing where the money runs out, to a much more nuanced approach of actually what are the strategic priorities. And certainly in areas like schools and hospitals where we are committed to providing adequate and safe buildings that these things can happen in. Frankly, whether or not they contribute to growth in as much as filling in some potholes does, those are just things that we need to do, and it's important that the Green Book process adequately reflects that. But I think that is an implementation of the Treasury's rules rather, needs to be done well, rather than the Treasury's rules don't allow you to implement them well. That would appreciate that.
Right. Anyone else want to come in on this?
I think one of the things that is quite an issue that I've always wrestled with wearing from the different hats that I've worn through my career is in the Treasury, it is very much a kind of Green Book, scheme by scheme, individual value for money. And then when I've been in a non-executive role in the NHS, one of the things that we're looking at in the NHS now, in integrated care systems, is how the health service contributes to wider economic and social development. And we talk a lot about things like being an anchor institution, our role. And when you're working with local government, and one of the things we haven't talked about is asset sales, because we also, we sit alongside, we have a huge capital need, and we have a lot of assets which aren't used very well and potential for asset sales. And it's incredibly hard to get public agreement to an asset sale. And one of the things that you're when you're trying to do locally is think, well, what's the community, the economic and social need for a place? How do the different social agents contribute to that? What do we need? Regeneration of a place, both from an economic and social point. How do you fit all these things together? If we could sell this to you, could you do some housing there, and we could do this there, and then you could use some of our facilities for this? And all of that sort of makes sense when you're thinking about trying to place shape. And then you try and put what you're thinking about as a result of that and able to broker with parties into the government rules and it collapses. And yet everyone kind of feels, hang on, we should be looking at these assets collectively. So, in the NHS, if we put our community diagnostic centres in the middle of towns, that's where all the bus routes go to, that's where people go, that's great. But also that means people are going in and then they'll probably shop and go for a coffee and all of that at the same time. And so, how can we start to think about that in that way? And it's really quite hard to make that sort of thinking work in the rules and the framework. And you have to achieve best value on your asset sale, but that doesn't work,
So what would be your solution? Does that involve giving more responsibility and decision-making powers to a more local level and trying to do less of that centrally at the spending review?
So I wish I had a fully worked out plan, but it does suggest that in the end, if these if our public services, and we haven't talked about housing, but you mentioned housing, if our public services are enormously important both for the delivery of public services and have a key role to play in place shaping, which influences wider economic and social development, you need someone who's thinking about that as a whole, don't you? Mm-hmm. And some autonomy and delegation for that. And so actually you do come back to sort of devolution. It's what, when you centralise this, do it by service, do it now. Even if Green Book allows you to take some account of this, fundamentally, the projects which the health service will prioritise are the health service. The projects the education will prioritise the education ones, housing theirs, and you miss these opportunities. And they're not just kind of value for money opportunities, they're often about how you, in a political, these assets belong to local people in their view, fairly reasonably, and it's their communities and their lives that are affected, and you are trying to broker something that works for local communities, aren't you? And it's ever so difficult to make a good decision about that in the Treasury.
Yeah. I think just to add a point to that element, I think often we don't look at how a project is an enabler for delivering a load of other stuff. Yeah. And coming back to your point, Thomas, in terms of the Green Book being quite a fixed framework of this is what it's got to look and feel like. But as you said, the strategic case and that case for change, and what's the bigger vision? What are we trying to achieve here? But it's often difficult to get to that when everyone just shoots to the numbers. How much money do we need? What's the payback and all of those measures? So it's how we get out of that mindset, which is difficult given the constraints we're in.
Great. I'll take some questions from the audience now. So I'll take a batch of a few. So we'll start down here. Please do say who you are, if you don't mind telling us.
Good afternoon, panel. My name is Jamie McCormack. I am a community health champion, practitioner, and an independent health researcher. So, insightful as ever, and I've watched a lot of the IfG webinars over the last few weeks. So the first thing I think we could unlock a lot of capital projects is just to make them more usable and make them more accessible. How many projects have we developed, especially within NHS, just the end user just goes, I can't use the app, I can't use that. Because we're not in the room. The one thing as an expert patient, I realise how quiet hospitals have become. That hum has gone, which means hospitals aren't being used very well. We also have a lot of empty free schools we could transfer instantly. So that's just one example. If we understand that there's a very short fiscal headroom, and there is, does it make sense to spend £2.8 billion on a new assessment service for disabled people in the DWP, an area we never talked about during the election? So that's £2.8 billion, which is going to have another impact cost on the Ministry of Justice, the health service, and on actual disabled people. It stops people from going back to work. It actually makes people sicker, which is great if you're profiting from that, but it's not great as an actual person. So what does community service mean? The best practice of state apparatus, big business, also community people who actually understand that environment. How does that work? Could we not redeploy that money we're using on that contract redeploy the staff back into HMRC to go and find tax evasion, because they become experts in finding fraud, and actually reinvest it in disabled people, which actually makes up a quarter of this population. The amount of talented people we've trained who can't practice because the physical infrastructure is inaccessible, the digital infrastructure is inaccessible. You take one example, Crossrail. We had to legally compel.
We need to get on to other questions. But
yes, but how does that actually work? Because there's a lot of win-wins to be had. So how is that actually going to work in practice?
Great, thank you. Take Tim right at the back.
Tim Loynig, Director of Economics at Public First Consulting and former civil servant, to ask the panel, but perhaps particularly Anita, about Treasury long-term thinking. In Germany, they have, in every year since I was born, electrified 200 kilometres of railway, plus or minus 10%. In Britain, I've just looked it up, we've yo-yoed between 0 and over 500. We don't have a standing team that does it at a low cost like Germany. We pay an absolute fortune when we do it. Why? I got nowhere, Anita, when I was in the Treasury and persuading them to do anything long-term. I just wonder if you had any better ideas than I do, because I have none.
And the lady with the gloss on her head, just...
Afternoon, panel. Julia Harnden, work for the Association of School and College Leaders. I'm a funding specialist. So the spending review is eagerly awaited and expectations are growing. I know we've got to be measured about it. But I just wondered from the education perspective, what sort of evidence should we be collecting and using to support our DFE colleagues in their bid to Treasury for the best outcome for capital spend?
Great, thank you very much. So a range of questions there. So we had a question from Jamie about how can users of capital be part of the process of thinking about what is the appropriate future estate. Tim, how do we get the Treasury to think long term and provide this sort of, particularly for these projects where we know there is a steady stream of things that we want to do on it. And Julia, how can the wider community provide the evidence needed to help build the case for capital spending? So, Anita, do you want to?
Yeah, so I'm going to take the first question, and I think there are three things that seem to me quite important about that. One is we'll have simultaneously assets, estate that are in a really poor state and lack of capacity, and we have underutilised assets that we're not making the best of. And it's always been interesting to me that actually in a lot of public services, we don't actually have a really good picture in a place of what our assets are across the piece and how we could use them. And in the health service, one of the things we're sort of thinking about is we've got a big, I mean, we don't own the estate, but there's a big network in pharmacy that we're, and we actually, we need a network of pharmacies. We're underutilising pharmacy. It's not very economic. So this is where I think actually it's really hard to do a capital plan without thinking quite broadly and starting with what's the point of the service, what it's trying to achieve. So the second point I would make is, goes back to some of the things about how we do spending reviews, and UK spending reviews focus very much on the allocation of margin. If we've got X billion more, where's it going to go if we're going to cut by X billion? What it doesn't do is think, if we've got some objectives, what's the totality of what we spend? What are the resources that we've got? And over a long time period, where do we want to be and how do we get there? And in shorthand, this is a bit more like the system that they use in the Netherlands, where you do these much more strategic reviews and you think how you get from A to B. And so if you take things like the outcomes for disabled people, if you look at children and young people, we're spending an awful lot at the moment in the upstream in managing crisis, rather than unlocking potential and enabling people to contribute. And we kind of know that. And you need a long-term perspective to be able to. First, you need to understand that, and then to move the resource. We've also got areas where we have invested, where at the moment we're not getting the benefit. So in the NHS, we put a lot of money actually into electronic patient records. A lot of the world has put money into electronic patient records, and we're not realising benefit as well, which goes back to the point that you make in the report that actually the production of the asset is the beginning and not the end. You know, and you do need to tie this into then. We do this, and a lot of the times when we don't get the benefit is because we've not worked with communities and we've not worked with service users and we've not worked with staff to really understand that. So in terms of the sort of, my plea for how to do this sort of spending review and to think about this, I think it's really important that we focus on the totality of the spend, not on the margin. The solutions are not on a margin now, and we need to get really focused on the objectives that we're trying to achieve, how we're going to unlock productivity gain and significantly reallocate resource, all of which can only be done through a longer term. So I hope that one of the experiences of the last 15 years is that you cannot be a successful country by being an exclusively finance ministry and a treasury, that actually to be a successful country we have to become an economics ministry very effectively alongside a finance ministry, which is all of Rachel Reeves' narrative. And you only become an effective economics ministry and unlock sort of further growth and potential and major productivity gains by taking a long term. There isn't a 10-minute, but it's quite a challenge. And I think probably what is really important in that is not to see this as maybe some of the problem, which is what Sue Gray is going to be looking at, isn't it, is that when the Treasury is so powerful and so dominant, it's quite hard to have that wider perspective. And you need a stronger Cabinet Office alongside this, and this agenda needs to be owned not just by Treasury, but Cabinet Office as well. But let's see. Let's see.
John, did you want to?
Well, I mean, just to respond a bit to Tim, I mean, I think it requires leadership, fundamentally. In the end, there's absolutely nothing to stop an effective Treasury from saying, right, we're going to have a 10-year plan for everything. We're going to decide what is our 10-year investment strategy. What proportion of national income do we want to spend on capital investment versus other things? How will we achieve that over a long period of time? If you were running the Treasury, I mean, there's nothing to stop you incentivising your staff to stay in the same place for a while until they've delivered something significant. There's nothing to stop you requiring people to go out into a delivery department or out into the public service more widely, requiring them to get some experience of actually doing something, and then coming back to Treasury with some actual skills in managing people and activities. At the moment, of course, the Treasury is a major problem. The Treasury is extremely powerful. It's full of very clever people who are, and always have been in my experience, much less than the sum of their parts, because it's a poorly led and managed organisation. And these things are simply acts of will. It just requires somebody to grip it and then manage people properly to do it. None of these things, and it's implicit in your question, Tim, what is the thing we need to do this? Well, just do it. There isn't a magic bullet here. All of these things can be done. We know that other countries, you mentioned the example of Germany, do these things as a matter of course, and they are amongst the most successful economically countries in the world. We should start taking some lessons from people who are doing it better than us.
Thank you. Wayne?
Yeah, just to build on John's point in terms of the question around budgets, I think what I will say in terms of why does it cost so much to do anything in this country, I think there is probably something around supply chains and I suppose the thinness of supply chains. I think often the government gets very obsessive about a small number of strategic suppliers, and actually I think there's a bit of a review of how procurement works in terms of opening up opportunities to tier 2 and tier 3 suppliers. Recognise there's risks obviously around that in terms of financial position and so on, but we have had some corporate failures at the very highest level. So I think just having a little bit more of an open mindset in terms of what can be done at various local levels, also size and complexity of the project, and trying to open the doors in terms of contractors who can then get involved in those projects, which in theory should drive competition. And just to sort of jump in with the lady's question in regards to education, I'll let John jump in on more detail, but I would, in my mind, from my perspective, I think the general sort of direction of travel is obviously more money is needed, but in terms of that education piece, in terms of how you'll be making that argument, I think there's those elements around demand and understanding, obviously changing geographies and demographics, condition of assets, I think is, I would say in terms of the education sector, most schools have a good idea of that piece around backlog maintenance versus the broader capital vision. And I think thirdly, that piece around whole system approach that we touched upon earlier on, and understanding what a particular geography looks like in terms of need and where there is an ability for schools to work together and the local authority to take a much more whole life view of what they're trying to deliver, as opposed to effectively having lots of one-to-one conversation with schools, which then makes it very difficult to actually progress items. But I'll let John jump in there.
Should I just add a tiny bit on education? I mean, there's one thing which would be incredibly powerful, which is if we could, as a system, identify really clearly what the level of total backlog maintenance across education is, because we haven't done that, and doing that well would be a powerful piece of evidence for government. So that's point number one. Point number two, which I mean may not be the direction you were thinking in, but I do think our school, does regard this as important, is helping the government to think strategically about what's the right balance of investment between schools and other children's services, because I think what we are experiencing is pressure for a range of reasons, some of which is to do with core funding, but quite a lot of it is to do with the collapse of other children's services in most local areas. And so I do think helping the government to think well about that, because I do think in this space, as in others, there's a risk that schools and hospitals, as you say, get the kind of political headlines and are seen as strategic priorities, whilst other services, which those of us working in schools and hospitals know are crucial, are not given the same salience in the public mind. And so trying to help the government to think its way through that and being supportive of some reinvestment in some of those services which we know to be important is I think, an important job for us to do as well.
Thank you. Unfortunately, we are slightly over time, so Tom, I'll give you the final word.
I'll just very briefly on the Treasury. I think the Treasury tends to, and I think civil servants tend to worry that they use the terms like they worry about binding their successors on things like this. And I think they're probably slightly burnt by the Building Schools for the Future programme, which was set up under New Labour and then scrapped in 2011. I think the lesson from that is you need to go for these longer term programmes where there's going to be genuine cross-party agreement. With things like schools and hospitals, that means picking an efficient, low-cost, standardised model where appropriate and being willing to commit to that and knowing that, yes, in 10 or 20 years' time, there is going to be broad agreement that we need all of these schools, probably not as much agreement that they need to be built by the finest architects in the land at slightly higher cost. So I think that will be the way to ensure what the Treasury needs to be satisfied with is that these long-term programmes are not ones that are going to be ripped up by the next government and easily attacked. So I think that is deliverable and that is doable, but that needs to be the condition that they see to make them be willing to commit beyond a parliamentary cycle.
Great. Thank you very much, Tom, and sorry for running slightly over time, but thank you all very much for joining us. The video and recording of this event will be available online if you missed anything or want to watch it back. Really big thank you to Grant Thornton for supporting this work and for supporting this event and taking part on the panel today. And thank you also to the other panellists, to John, to Anita and to Tom. So please join me in thanking panellists.